So hello everyone, welcome back to Pen and Paper. Today we are going to discuss the topic professional misconduct. This topic is one of the most important topics from forensic medicine and we will try to cover this topic within 10 minutes. First, what is professional misconduct? Professional misconduct, also known as infamous conduct, means any conduct of doctor which is disgraceful or dishonorable as judged by professional men of good repute and competence. Okay, so who judges? Professional men of good reputation and competence. It involves abuse of professional position. Now, what are the acts amounting to professional misconduct? First, unethical practices as laid down in professional codes. So there are professional codes, right, in which there are unethical practices noted. So they amount to professional misconduct. Failure to maintain indoor patient records for 3 years and refusal to provide them within 72 hours on request. So a doctor should maintain patient records for 3 years and provide them within 72 hours if requested. Not displaying State Medical Council registration number on prescriptions, certificates and clinic board. So displaying State Medical Council registration number is important. Unauthorized absence from duty, rural posting or medical college facility on more than 2 occasions. Submitting false or misleading information to MCI, which is now replaced by NMC, that is Form A. What is Form A? It is the doctor's official certificate saying that a person is sick and needs rest or leave. So, doctor should not produce false or misleading information such as a false certificate. Adultery or improper behavior with a patient. Drunken or disorderly behavior affecting medical practice. Conviction for offences involving moral turpitude. Now, what is moral turpitude? Behavior that is grossly immoral, dishonest, or unethical which goes against accepted moral standards of society. In simple words, it means an act that shows bad character and moral corruption. Okay? Then ninth, sex determination for female feticide and violation of related laws. Issuing false or misleading medical certificates. Violation of Drugs and Cosmetics Act, including sale of Schedule H or L drugs to public and irrational use of steroids or psychotropic drugs. So, Schedule H drugs are prescription-only medicines that cannot be sold without a registered medical practitioner's prescription to prevent misuse, resistance and harm. For example, anti-TB second-line drugs. These are Schedule H drugs. Schedule L drugs, these are medicines meant only for hospitals and institutions and not for retail sale. These drugs are not sold to public. They are for institutional use under supervision of doctors. For example, vaccines supplied to hospitals. So, irrational use of these medicines and sale of Schedule H or L drugs to public. This is the violation of Drugs and Cosmetics Act, which a doctor should not do. 12. Supplying addiction forming drugs without medical indication. Covering unqualified persons to practice or perform procedures. Illegal abortion or illegal operations. issuing certificates to unqualified person. So that person is not qualified, but you are issuing them the certificate that they are qualified. Disclosure of professional secrets. Refusal of indicated procedures like sterilization, MTP or contraception on religious grounds. You should not discriminate. Publishing patient photographs or case reports without consent of the patient. Advertising using touts or agents claiming false specialization or displaying improper signboards. So what does this point mean by touts? Touts are persons who are not doctors and act as agents or middlemen for commission or reward. So promoting a doctor or hospital by using middlemen, that is touts, who bring patients in return for money, commission or benefits, is included in the professional misconduct. Conducting research or clinical trials without ICMR guidelines and consent. So, while conducting a research or clinical trial, you should always follow ICMR guidelines. Now, there are these important offenses, also known as 6 A's, because all of them almost start from A. Association with unqualified persons. Advertising, abortion, that is criminal abortion, then adultery, addiction, drug misuse or drug supply, then alcohol, professional misconduct due to intoxication. So these are the 6 A's. These are important offenses. So you can remember those 6 A's by this cartoon. So to remember all of these acts included in professional misconduct, you should categorize them. First, codes, certificates and records. Then drugs, crimes and not doing. Then behavior. Okay. So first, codes, certificates and records. Professional codes, ICMR codes for research. You should follow them. Form A, medical certificate, unqualified persons. You should not issue a certificate to unqualified persons. Then records, you should maintain patient records for 3 years. SMC registration number, you should display it. Then drugs, crimes and not doing. Drugs, alcohol, schedule H or L drugs sale, supplying drugs which cause addiction without any indication. Then sex detection is a crime. Illegal abortion is a crime. And you should not do unauthorized procedures. Also, you should not deny a patient sterilization, MTP, contraception on the religious grounds. And behavior, it includes adultery, advertising, moral turpitude, professional secrets. You should not leak patient photos, covering unqualified persons. You should not do that. So that was all about the topic professional misconduct. In this video, we discussed its definition, acts amounting to professional misconduct, then important offenses, 6 A's, and a way to remember all of these acts included in professional misconduct such as codes, certificates, records, then drugs, crimes, not doing and behavior. Subscribe to our YouTube channel for more exam-oriented explanations related to SAQs and LAQs of important topics covering MBBS subjects. Join our Telegram channel for notes and follow our Instagram page for must-remember exam points, mnemonics and previous year MCQs. We will talk about another topic in the next video. Thank you.